Dermatologist at Rainbow Children's Hospital, Road number 2, Banjara Hills, Hyderabad. Today I'll be talking about leprosy. Leprosy is a bacterial disease which is caused by Mycobacterium leprae. It is the disease that has inflicted humanity, leaving a terrifying image and human memory of mutilation and rejection from the society. It has left a lot of people with disabilities and very drastic exclusion from the society. It is the disease that it is mostly caused in a ratio in males to female in a ratio of 2:1, and the incidence rate has come down a lot. It from 9.7 to 5.52 from the year 2014 to 2022. Now this disease mostly affects the skin, peripheral nerves and the upper respiratory tract airways. In skin, we see lesions like macules, papules and nodules, which may be single or multiple. Coming to nerves, it is mostly seen as the main typical sign of leprosy. What is called is the sensory loss, and also we see thickening of nerves, and because of these sensory loss, we see a lot of deformities because the patient is not able to sense what injuries it inflicts, and they'll further land up with ulcers, and which are known as trophic ulcers, which also leads to deformities like the mutilation of digits, and there is also depression of the nose bone also. Now, how does this disease spread? Now, this disease mostly spreads from it is not known how it spreads. It is stipulated as it spreads from skin contact. Insects act as vectors through their bites and through respiratory tract also. Now, coming to the diagnosis is based on the WHO criteria. The main criteria for diagnosis is a patch of loss of sensation. There may be a thickening of nerve, and the patch can be light in color, which is known as hypopigmented, or it can be reddish in color. Loss of sensation may be there, or maybe there may be decreased sensation. The most important criteria for diagnosis is the skin positivity with AFP titer. The skin smear is positive for AFP. Now, how is this disease treated? This disease, before treatment, let me get you to the types of the disease or the classification of leprosy. Classification of leprosy is basically done on the number of bacilli present in the disease involvement. So when it is less bacilli, it is called paucibacillary, multibacillary, more bacilli, and there is a borderline variant. Now, our treatment again differs on the amount of the bacilli found in the smear. So for a multibacillary leprosy, we do a multi-drug therapy which comprises of rifampicin, clofazimine and dapsone, which is given in a period of 1 year. The paucibacillary treatment is done for a period of 6 months with only 2 drugs, that is rifampicin and dapsone. India is well equipped with learned dermatologists to detect and manage the disease, which has been a good criteria for eradicating the leprosy. Hence, we see good amount of the incidence has come down, as I have told you in my talk before. Thank you.